Folks are still coming in, but I just wanted to offer a welcome to the Collaborative Center's Climate and Health Seminar Series. We're excited for our session, The Health Case for a Fossil Fuel Advertising Ban, where we'll hear from Dr. Samantha Green and Leah Temper. For those who may be joining us for the first time, the Collaborative Center for Climate, Health, and Sustainable Care is an academic unit at the University of Toronto that catalyzes climate and sustainability research, education, and practice change in clinical care, health system management, policy, and public health. The Collaborative Center is an initiative of 4 faculties: the Dalalana School of Public Health, the Temerty Faculty of Medicine, the Lawrence Bloomberg Faculty of Nursing, and the Leslie Dan Faculty of Pharmacy. And our Climate and Health Seminar Series brings together international and local experts through seminars, workshops, roundtables, and working in partnership. My name is Edward Shia. I work as an emergency physician and assistant professor in the Faculty of Medicine, and I'm a member of the leadership table of the Collaborative Center. I'm based in what is colonially known as Toronto on Treaty 13 territory. And I'd like to open the session by acknowledging the land on which the University of Toronto operates. For thousands of years, it has been the traditional territory of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. I recognize that this meeting place is still the home to many Indigenous people from across Turtle Island, and I'm grateful to have the opportunity to work and learn on this land. And germane to the topic today, I'm also grateful for Indigenous resistance against fossil fuel pollution and extraction. A 2021 report by Indigenous Climate Action and others found the equivalent of a quarter of US and Canadian greenhouse gas emissions were avoided or delayed due to the actions of land defenders. And that includes the Northern Gateway Pipeline, opposed by the Inca Dene Alliance, the Hayatsuk Nation, Coastal First Nations, Wet'suwet'en First Nation, among others, and the proposed Energy East Pipeline, opposed by the Wolastoq Nation, Anishinaabe, Haudenosaunee, Kanesatake Mohawk, and many other Indigenous groups. Without their resistance, we would not have the good fortune to discuss preventing fossil fuel extraction today. So I'm going to just give you a quick outline. We've got 35 minutes for the presentation from our speakers, followed by about 15 and 20 minutes of Q&A. And I'd like to now introduce our 2 speakers. So first is Dr. Samantha Green. Samantha is a family physician at St. Michael's Hospital and Intercity Health Associates. She is president of Canadian Association of Physicians for the Environment, or CAPE, and co-director of the Faculty of Medicine's Planetary Health Certificate Program, and co-chair of the CanMed's 2025 Planetary Health Committee. Samantha has collaborated with Cascades on the Climate Conscious Inhaler Prescribing Playbook, and she's currently engaged in an academic project to educate case managers and psychiatrists on the risks of extreme heat for people living with schizophrenia. And Dr. Leah Temper is the director of the Health and Economic Policy at CAPE, where she works on greenwashing, fossil fuel advertising, corporate accountability, and healthy information ecosystems. An ecological economist and scholar activist, she has taught at the Beeler School of Environment, McGill, and the Autonomous University of Barcelona, where she co-led the activist academic co-production of knowledge for environmental justice project. She co-founded the Global Atlas of Environmental Justice and is one of the world's 2% most cited scientists. Top 2%, including the works Ecological Economics from the Ground Up and Just Transformations, Grassroots Struggles for Alternative Futures. Thank you to both of you for joining us today. And just for housekeeping, I'd like to remind everyone that these sessions are recorded and posted online at the Collaborative Center's YouTube channel with links to our website. I'll also ask that you please keep yourself muted and kindly put your questions and comments in the chat, and we'll try to triage those at the end of the presentation. All right, so I'm going to hand it over to Drs. Green and Temper.
Thank you. Thanks, Edward. Thanks for having us. I'm really excited to be part of the Collaborative Center's Critical Conversation series. There's been some really interesting webinars in the series so far, so excited to be a part of it. I'll dive right in. Neither Leah nor I have any financial disclosures. As you heard, we are both part of the Canadian Association of Physicians for the Environment. I'm the president of the board, and Leah is staff. But I don't think that poses a conflict of interest in the case of this presentation. So these are the learning objectives for today's presentation. We're going to talk about the commercial determinants of health. It'll be a bit of an introduction for those who aren't familiar with that framework. We're going to draw lessons from tobacco control for health protective climate policy. And we're going to talk through the benefits, limitations, and challenges of a fossil fuel advertising ban. So we all know fossil fuels cause harm. Um, Fossil fuel air pollution is responsible for 1 in 5 premature deaths globally, and 1 in 7 premature deaths here in Canada. Globally, it's been estimated about 8.7 million premature deaths per year are caused by fossil fuel air pollution alone. And then there are additional health harms from extraction of fossil fuels, extraction projects like LNG extraction in northwestern British Columbia, and other extraction projects across Canada and around the world. And then finally, there's, of course, the health harms of climate change. It's been estimated that climate change is causing around 250, at least 250,000 deaths annually from 2030 to 2050. But some estimates actually put the number closer to 1 billion deaths by 2100. Um, these numbers are about equivalent to tobacco, or in some cases, exceeding the health harms caused by tobacco. Adaptation and sustainable healthcare is not enough. Obviously, it's really important that as health professionals or people in the healthcare sector, we support our patients and communities in becoming more resilient and adapting to the changing climate. It's also really important that we take action within the healthcare sector and ensure that we're not causing harm from the actions that we take within the healthcare sector, reducing the emissions, reducing the environmental harms that we cause from the provision of healthcare. But these two actions are insufficient to actually protect our patients, our communities, and global health from the harms of fossil fuels. So it is critical that we as health professionals examine and address the upstream commercial and political drivers of these harms. Among the emerging strategies under consideration is a restriction on fossil fuel advertising. And so that's what we are talking about here today. And this is a measure that draws inevitable comparison to tobacco control policies. But how valid is this analogy, and does it help us understand the role of corporate influence in perpetuating health harms, or is it an oversimplification? That's what we're going to discuss in the next half hour. So, what are the commercial determinants of health? This is a framework defined by Anna Gilmore in The Lancet in 2023 in this seminal paper, and actually a series of papers that were published in one journal issue. She defines the commercial determinants of health as the systems, practices, and pathways through which commercial actors drive health and equity. And this provides a critical lens for understanding how corporate practices shape health outcomes and impede regulatory efforts. Commercial actors spend resources and use marketing and lobbying to oppose public interest regulations and shape scientific evidence and public discourse, all with the aim of blocking, delaying, and weakening health protective policies in order to increase their own profits. The egregious history of the tobacco industry's influence on science has been widely documented, and other industries, including the fossil fuel industry, have engaged in similar practices. So here's a pop quiz. We weren't together enough to actually put up a quiz in Zoom, but this is more for your own self-reflection. How many premature deaths per year are caused by a combination of tobacco, alcohol, ultra-processed foods, and fossil fuels? I'll give you a second to consider that question.
Feel free to put guesses or your what you think in the chat if you would like.
It's actually more than 1/3, and that was an estimate from 2019 from the World Health Organization's Global Burden of Disease study. So these four commercial products are responsible for more than 1/3 of premature deaths globally. So the Lancet paper that I already referenced that defined the commercial determinants of health also described how these commercial entities shape health and well-being. And this interference operates through multiple channels. So they operate through direct product promotion, marketing. That's really what we're focused on here today. But also through corporate messaging that obscures health risk, through political advocacy that undermines public support for health protective policies, through the production and use of fake science to ensure favorable outcomes for industry, and from financial practices, things like price fixing and tax avoidance. And there's a huge amount of evidence and examples from the tobacco industry for each of these categories. The paper is well worth reading for these many examples. For example, in one instance, British America Tobacco paid as little as $3,000 in bribes to change legislation in Burundi. I mean, that's just one small example, but the paper goes through many examples, and not just from tobacco. There are also examples from alcohol and highly processed foods and fossil fuels. And yes, I said that. So fossil fuel companies, including ExxonMobil and Shell, first learned about the risks of climate change well before the 1970s. Internal reports accurately predicted the scale and timing of global warming, but these findings were not disclosed to the public. Instead, companies funded think tanks, public relations campaigns, and industry associations to cast doubt on climate science and emphasize uncertainty with the explicit goal of delaying regulatory action. And industry documents actually reveal the explicit adoption of tobacco industry tactics, including, in some cases, hiring the exact same public relations firms and scientific consultants as big tobacco companies, and pursuing this strategic goal to reposition global warming as theory rather than fact. So these are two advertisements from the 1990s. And then you can see here a couple of examples of tobacco advertisements from the 1970s. And you can see both industries employing similar messaging strategies, emphasizing personal freedom, framing regulation as government overreach, and promoting supposedly cleaner alternatives, light cigarettes or so-called less polluting, quote, natural gas. And fossil fuel companies are often using these misleading comparisons, just like tobacco companies. Fossil fuel advertising also, like tobacco advertising, justifies the use of their product in order to have economic growth, or they associate their product with positive social well-being. And so, this is an example of a 1960s British advertisement, but you can see that in this case, this is a screenshot from just the last few months from the Irving Oil website. And you can see that these contemporary fossil fuel advertisements can continue these deceptive practices, associating their products with positive emotions and feelings of well-being and positive economic growth. Tobacco companies have also historically leveraged what's termed the halo effect by sponsoring arts and culture and sports events, associating their harmful tobacco products with positive emotions. So in this case, there's the Du Maurier tennis tournament and the camel race cars. Now, this was explicitly prohibited under the WHO's Framework Convention on Tobacco Control. They called it brand stretching, which is where a tobacco brand was connected with a non-tobacco product in a way to provide positive emotion or positive feeling about the tobacco product. This has been explicitly prohibited. And you can see that fossil fuel companies continue in this tradition. And here's a photo of the Enbridge sponsorship of Ottawa Winterlude. So I'm going to hand it off now to Leah to talk about whether ad restrictions and ad bans work.
Thank you, and it's great to be here. So the precedents we have for ad restrictions of harmful products, of course, tobacco is the most well-known example, but actually all of the major products that Sam had mentioned that contribute primarily to premature deaths, including highly processed foods, alcohol, and tobacco. There has all been movements to have restrictions on ads, and systematic reviews show that they do work. So for tobacco advertising, there's studies that show that they reduce consumption by 6 to 7%. Some studies have found reduction, of course, in overall mortality as a result. Recently, the London Tube Network, so Transport for London, banned ads in 2019 for the advertising of high-fat salt and sugar products. And modeling has shows that there's already been a 5% decrease, almost 5% decrease in obesity, reduced diabetes, and cardiovascular disease. And these showed up within years. And of course, this is a very limited ban that was only on the London Tube. Studies on alcohol marketing also show reduced consumption of alcohol, particularly amongst youth. Next slide, please. And then another interesting example, and this dates back to the setting of the International Code of Marketing on Breast Milk Substitutes since 1981 that 180 countries have signed. So countries that are implementing this restriction on the marketing of formula show higher breastfeeding rates and declines in infant morbidity and mortality related to formula feeding. And there's studies, for example, from Tanzania and Ghana show that those after the implementation of the code, there was a significant reduction in child mortality. And the motivation for limiting the marketing of formula and breast milk substances is that mothers should be able to take decisions free from commercial interference and free from commercial influence. So we believe that we're going to expand a little bit on how we think these mechanisms could work in the case of fossil fuels. So what would an advertising ban? Oh, and I should say that, those studies, they are modeling sort of very direct changes through direct consumption effects, but they are likely underestimating the health impact for some of the reasons and the causal pathways that we're going to discuss further on. But that, of course, it's very difficult to capture the health impacts and how the marketing influences health, because these are very complex pathways that are not easily captured in traditional epidemiological studies. So what would a fossil ad ban look like? So it could look like different things, and we kind of divide it into 3 levels. There's a product level. So a product level ban would refer specifically to fossil fuel products. This would be ads for your gas station like Petro-Canada or Tony the Tiger. Ads for gas utilities. You should install gas in your home. Then there's business level ads. We've been seeing these more and more across Canada. So this could include sponsorship of the type we've been seeing of different events and organizations. And then we have, you'll see a bit further on, Pathways Alliance did a multi-billion-dollar ad campaign about how they're getting to net zero. It can also include fossil-intensive products. So some countries have put in place ads, of course, for gas-powered vehicles, gas-powered leaf blowers, and some have even put in place ad bans for meat or other emissions-intensive sectors. And finally, it can also look like restrictions on greenwashing, which we've also been working on here in Canada, which essentially limits companies' possibility to give a false impression about their environmental credentials. Next slide, please. So, has anyone put in place such an ad ban? Yes. So France was the first country to ban fossil fuel ads. And they focus on the first. So they have banned ads for oil, coal, and they recently added gas as well. And also, a bunch of cities around the world have banned fossil fuel ads. So, actually, last week or 2 weeks ago, Amsterdam became the first capital city to do a fossil ad ban through law. Florence is the first Italian city that has recently banned fossil fuel ads, but there's about 40 different cities around the world that have banned fossil ads. And Spain is also considering a ban on fossil fuel advertising through their sustainable consumption law. And here in Canada, there was a bill tabled that was heavily supported by CAPE, an act respecting fossil fuel advertising that was tabled as a private member's bill, but it unfortunately died on the order paper when the elections were called. Next slide, please. And there is a lot of international momentum from the highest level calling for a fossil fuel ad ban. So Antonio Gutierrez, the chief of the UN, made a call for fossil fuel ads to be banned, like cigarette ads, saying we need to stop fossil fuel advertisers and the agencies that promote them as enablers of planetary destruction. And also the special rapporteurs the special rapporteur on climate change and human rights has also called for a fossil fuel ad ban. So how would a fossil fuel ad ban actually work in practice? And how would it potentially lead to health benefits? So the first example, or what we would call the mechanism of impact, is direct demand reduction. Uh, so this essentially would work primarily through reducing ads focused on high carbon products and discretionary fossil fuel consumption. And this would probably be most effective where there is consumer choice and alternatives. So just to give you a sense regarding oversized vehicles, right now about 80% of car ads in Canada are for oversized vehicles, SUVs, which are about 30% more polluting than your average vehicles. And 80% of the cars bought are also for oversized vehicles. So we see this immediate connection between advertising and these sort of aspirational goals that are leading people to continually buy oversized vehicles in Canada. Another clear example is there's of course, a big push for continuing to encourage people to install natural gas in their home or to have a gas stove and here you will see this is a sponsored ad from the Canadian Gas Association that says, why natural gas is the smart choice for your new home. Um, and they talk about how you have heat control and a superior cooking experience. And right next to that, you can see our corrected version of the ad. We say natural gas is the wrong choice for your new home because it increases your children's chance of experiencing asthma symptoms. But of course, as a public health organization, we don't have similar budgets to get this message out. So how do we counteract and make sure that people get the information they need to take informed decisions? And I've just included also a recent study that showed how the health benefits from this shift can be immediate. So a program in Ecuador to encourage electric stove adoption led to a lockstep fall in hospitalizations in line with the increase of the uptake of induction stoves. So this is sort of based on consumer preferences. And of course, there's some limitations because changing your stove, for example, once you have it, is not easy. Some of these products, like a car or a stove, last a long time regarding the replacement cycles. Um, but that's no reason not to, because because of these long time frames of locking yourselves into fossil fuel use, I would say that increases the reason. Next slide, please. So the second one is norm shaping, and this is also shown in tobacco control research, the importance of denormalizing behaviors beyond their direct consumption effects. And this norm shaping function could be particularly relevant. And as Sam mentioned, it's not only about promoting specific products, it's about promoting a lifestyle and ideas about what prosperity, progress, and the good life look like. So there's research on social tipping interventions that suggests that changing advertising could really lead to cascading norm changes to accelerate energy transition dynamics. And yes, of course, we want to reframe basically the idea of carbon intensive consumption as socially irresponsible rather than aspirational. Next slide. The third mechanism of impact is protection of democratic discourse. And of course, here you can see some examples. Ads are not only directed at consumers, they're also directed at citizens who take decisions as they vote, and of course, to political decision makers. And they are used to exert political influence, to manipulate in the media, to deflect corporate responsibility, and to spread misinformation. And here you see this is an example of the Pathways Alliance ad, the industry largest ad campaign that ran 2 years ago about how oil sands are on a path to net zero. And today our Prime Minister is talking about decarbonized oil. So we can clearly see the influence of these campaigns. And this political dimension certainly justifies restrictions, regardless of the direct consumption effects. So there's been a few studies showing about how Pathways Alliance use their advertising to undermine climate action in Canada. You can go to the next slide. There's also a lot of evidence about when fossil fuel companies spend money on advertising. So in the lead up to COP30, this is sort of a month-by-month analysis where you can see how much they've spent on advertising in Brazil. And there's also examples from Canada. So this is from 2018, where the oil lobby targeted 13 Ontario swing states to push for the building of a pipeline. And of course, they have almost unlimited resources in order to sway elections and to sway decision makers to, put in place policies that benefit them, counter to health protective policies. And of course, we have a great precedent here, again, from the Framework Convention on Tobacco Control, where Article 5.3 provides a precedent for measures that prevent industry interference in public health policymaking. So we need to understand how industries are affecting public health policymaking and how this interference and influence can be constrained. Next slide. So, as we said, are tobacco and fossil fuels the same? Does this metaphor work? How useful is it? So there are key differences. Firstly, fossil fuels are not pharmacologically addictive, and we are still structurally dependent on fossil fuels in a way that we are not, of course, for tobacco. So this structure means that it can make it harder for individual consumers to take a choice. You don't choose how your electricity is generated. Choices about transportation, your home heating are certainly constrained by structural factors and the available infrastructure. But there's also other differences as well that we would say sort of increase the ethical imperative for banning fossil fuel ads, even more so than tobacco. And this is about how the harms are perpetuated from these products. So tobacco primarily harms the user and those around them, whereas we know that from fossil fuel use, the harms are primarily accrued to externalized to non-consenting populations. And this is particularly to future generations, children, and other climate vulnerable communities. So, because of the way that these burdens are put on future birth cohorts and vulnerable populations who are not able to consent, this displacement of health impacts and intergenerational harm uh, this has been termed by the Special Rapporteur on Climate Change and Human Rights an astonishing betrayal. And the distributive justice implications of this really kind of uh, calls for uh, further action to ensure that these harms do not accrue. And we would say that raise the ethical imperative for a fossil ad ban. Next slide. So there are, of course, significant implementation challenges. How do we regulate online fossil fuel ads? What about marketing and sponsorships? How would we reduce the money that is going to arts, culture, and sports? Of course, there's a lot of third-party groups, sometimes called astroturf groups, that are also doing advertising and trying to push policy change on behalf, sometimes funded by fossil fuel companies. And of course, there's significant political feasibility issues and pushback because of the entrenched political power that these companies have. And of course, we need more than an ad ban. This is just one policy that needs to work with a whole suite of climate policies. Thank you. Over to you, Sam.
All right. So what can we do? What can those of us who are here in this webinar, what can health professionals do? And why us? All of us know this. Health professionals are trusted messengers on the climate crisis, not just primary care doctors, as you can see in this study from Edward Maybach, but also nurses and other health professionals. And because we are highly trusted, that gives us a moral imperative to speak out on this issue and to act politically. And health professionals have also historically played leading roles in campaigns to regulate advertising for tobacco, alcohol, and unhealthy foods. And the credibility of health professionals as trusted messengers positions us uniquely to put forward the fossil fuel advertising ban proposal. Physicians for Smoke-Free Canada led the call in Canada for a comprehensive advertising ban and tobacco control, first calling for a tobacco advertising ban in the late 1980s and early 1990s. And we have this precedent of the WHO Framework Convention on Tobacco Control, which was led by health professionals. It was ratified in 2003 and entered into force in 2005. And it was launched together with this package of strategic policies called Empower, which consisted and consists of 6 cost-effective, evidence-based measures designed to help countries implement the WHO FCTC. And it includes advertising bans, but it goes beyond advertising bans. And many of the tools in Empower we could actually apply to fossil fuels and greenhouse gas emissions, monitoring their use, protecting people from air pollution and the health impacts of climate change through adaptation, helping individuals get off fossil fuels, stopping greenwashing, banning advertising, and then, taxes. There's the failed carbon tax example that we could look to. And through Article 5.3 of the FCTC, there's also this explicit reference to protecting public health policies from commercial influence. Similar measures, combined with similar advertising restrictions, as those in the FCTC, would address the outsized influence that the fossil fuel industry has on climate policy here in Canada and globally. Oh. Leah mentioned the increase in advertising ahead of the of COP30 in Brazil. Well, the industry influence that we saw at COP30 in Brazil was also something else. There were more than 1,600 fossil fuel lobbyists granted access to COP30, which was the second largest delegation after Brazil. And this was actually a 12% increase over COP29 the previous year, and the largest concentration of fossil fuel lobbyists at any COP ever. Whereas, no industry was permitted at the table when the WHO FCTC was written and created. And we can look to other examples where industry has also been banned. So, for example, in the development of the 2019 Canada Food Guide, no industry was permitted to contribute to its development. And that's a great precedent to look to. So what else can we do to address the commercial determinants of health broadly as health professionals, as civil society actors? Well, there's this paper actually published alongside the initial introduction to the commercial determinants of health. This paper by Sharon Friel describes these 4 actions that we can take as civil society actors. And each of these we can apply to fossil fuels and climate change. Number 1 is to build coalitions to amplify power, to widen appeal to diverse constituents and convince policymakers to act. There are many of examples in tobacco control, but there's also the example of the Global Climate and Health Alliance that's connecting health professionals around the world to advocate for climate action. Number 2 is educating the public and engaging in mass public health campaigns. And the example in this paper is a really good one. It's South Africa's Treatment Action Campaign, which forced global pharmaceutical companies to improve access to ARVs. And they really did that by engaging in mass narrative change with the public. And so that's what we need to do with climate action, is really engage in this mass narrative change. There's strategic litigation, and an example right here in Ontario is the Mather case, where 7 youth have sued Doug Ford for a lack of climate policy here in Ontario. And we'll see what happens with that. They've just announced yesterday that they're bringing it back to the Court of Appeal. And then the final example is disrupting the status quo through boycotts, strikes, and demonstrations. And there's a really great example of that from tobacco control, this campaign called Bugga Up, which began in the late 1970s in Australia. It stands for Billboard Utilizing Graffitists Against Unhealthy Promotions. This is an example of their work. And it's a great example because there was a participation of doctors and other health professionals in this group. And it was also a really fun example of disrupting the status quo.
And so here, are you going to show the slides? So CAPE has been mobilizing the health community in Canada for a fossil fuel ad ban over the last 3 years. And about 3/4 organizations, about 30 health groups representing close to 750,000 health workers across Canada signed our call asking for a comprehensive fossil fuel ad ban and robust regulation of greenwashing in Canada. And we also there we are. So here's the campaign. You can find out more at cape.ca and stopfossilfuelads.ca. You can go to the next slide. We also, as I mentioned, Charlie Angus from the NDP tabled a bill, Bill C-372, an act respecting fossil fuel advertising. Next slide. And the bill was not popular with the fossil fuel industry. So there was quite the pushback to the bill. And this really shows, I think, the effectiveness of the bill because they were so scared about something like this happening. So it really shows the power that something like this could have in terms of denormalizing fossil fuel use and delegitimizing the companies that are trying to obstruct climate action, and of course, shape public policy to their benefit. Yeah, and it got to the point where Charlie actually had death threats. At the municipal level, there's also been some small successes. So the TTC took some steps towards a ban on misleading fossil fuel ads, and the Société de Transport de Montréal has completely banned fossil fuel ads in the network. We're happy to say. And we've also had some significant advances on passing greenwashing legislation. So, Bill C-59 reversed the onus on companies if they're making green claims. They need to back them up, which seems reasonable. But the reaction has also been extreme. And here you can see the Pathways Alliance, their website, before the law was passed, where I mean, it's the world, some of the world's biggest industrial polluters, and their webpage is of clear blue skies. And then you can see their website after the fact, where they actually took down their entire website. Um, so there's been recently in the MOU with Alberta, actually, the Carney government committed to rolling back some of these wins that we got in the greenwashing law. That has not yet been passed, and it's still an advancement, even if they're rolled back according to what is proposed, but we are still trying to maintain as much as we can these basic truth in advertising laws. Next slide. Oh, and we've also been working on fossil fuel influence in schools. So we published a report, Polluting Education, that documents how fossil fuel companies are essentially creating curricula about climate change and environmental education in K-12 education. I'll put the link also to the report. And there's also been some advances on there, particularly in BC, asking the Minister of Education to ban fossil fuel promotion in our schools because, of course, the people that created the problem should not be teaching our children how to address it.
And this is our final slide. We hope that one day fossil fuel advertisements will be as ridiculous looking as these tobacco ads.
Great. Thank you so much, Doctors Temper and Green, for the presentation. That gave us a really clear understanding of the commercial determinants of health and fossil fuels. We've got about 15 minutes for Q&A, so please put your questions in the chat. While we're waiting, I'd like to start us off with a question. So on the impact mechanisms of ad bans and entrenched political power that you've mentioned, I'm thinking of climate policy scholar Jessica Green's work. They argue that we're too focused on tracking emission metrics, and efforts to decarbonize need to shift focus to assets, that fossil fuel asset values underlie political power and the power to continue polluting. I'm wondering, what does a fossil fuel ad ban do to that commercial and political power?
Yeah, I think that's exactly, I mean, that's is exactly what we are arguing, that this type of social power, I mean, if we look at how the commercial determinants of health work, we see how they sort of maintain legitimacy, maintain social power, are able to control our information ecosystems, structure sort of what we conceive as possible, structure ideas about what the good life is. So an ad ban is, we think, a sort of a clear step to beginning to chip away at that power. I'm not super familiar with the work of Jessica Green, but I would love to read it. And yes, I don't know if she's talking about nationalization of assets of oil companies and so on and so forth, or what that would look like. But certainly in terms of the discursive power, uh, an ad ban has it has obviously would have a huge impact. And we have seen a sea change in how tobacco companies are considered. They are, they have become pariah actors in society.
And I think it also speaks to the importance of an advertising ban along with other measures to address the commercial determinants and the power that these fossil fuel companies have, like through Article 5.3, really banning the fossil fuel companies from having a seat at the table at these international negotiations, but also in the formation of national climate policy. Now, how to address the fact that they have so much power now that we are unable to move these things forward is another question, and I guess entirely.
Thanks to both of you. I think, uh, it, her work kind of touches on some of the points that you raised in terms of potentially, regulation and taxes and green industrial policy, and potentially an ad ban could indirectly reduce revenues as well. I see a question from Leila Rashidi, and I'm going to read it out so I don't miss anything. So, when talking about things like buying SUVs and gas stoves, with these things being hard to replace once purchased, how would you compare the fossil fuel detriments of buying and continued use of the wrong thing versus trying to make use of what you already have and preventing emissions resulting from production of these vehicles or appliances?
Um, So, so this is a funny one, I find. I mean, just to give you an example, so right now I don't have a car. I've been using Communoto, and then I looked into buying an electric car, and I was like, well, I drive very little. So it would make no sense for me to have an electric car. Actually, I should have, the most polluting car because my car is just sitting in my driveway or in my backyard most of the time, and I would use it so rarely, so it would, it it would pollute very little, for example. And of course, there is an energy cost of having an electric vehicle. So I always say that, I think it's not about, like, for many of these things, it's not about the your individual green glow related to your consumption. It's These are sort of structural, like, this is why we say that there are structural questions. So when I talk to taxi drivers, that are they're driving hundreds of kilometers per day, every day on the road, emitting those fuels. I'm like, they need to have electric cars. I don't necessarily need to have electric cars. When it comes to gas stove use, also, I mean, and this is also the question of, like, who's inside the car and who's outside the car. So, the example of greenwashing that we use, the biggest case that was ever settled for greenwashing was against Volkswagen for their Dieselgate scandal. The only people that were compensated, so they lied, they did a trick to trick the emissions regulators for their diesel cars. And when it was found out, the people that were compensated were the people who owned the cars. But when you're inside the car, you're not breathing those extra emissions. It's everybody on the street and those who have vulnerable health issues who are actually breathing that air. And there was studies in Europe about, thousands, tens of thousands of people lost years of their life as a result of that scandal, but they were never compensated. Um, So, I mean, with gas stoves, of course, the health impacts are like, more on you and in your home. And of course, if you have children with asthma or you have asthma, certainly there's all the more reason to replace it sooner. But yeah, I think there's many considerations because if you're just gonna, of course, sell your gas stove secondhand to someone else will be using it, of course. So I think that
I mean,
bigger picture
and
thinking.
engineers have done that life cycle analysis also. I mean, I'd have to look it up, but I'm sure that it's been calculated at which point in the life of your stove it makes sense to replace it with an induction stove. Someone has measured that, I'm sure. But and the advertising ban obviously wouldn't be about those individual choices. It would be about, consumers, society as a whole, not being sold this false, healthy, good cooking option. But instead, the default when you're going to buy your new stove would be an induction.
Great, thank you. Please keep the questions coming. I definitely don't want to be the only one asking questions. But since I don't see another one right now, well, first I'll say thanks for mentioning Kaminoto. It is excellent. If anyone needs to drive and available in many provinces, I did a road trip in Nova Scotia with Kaminoto last summer. It's fantastic. Um, I'm wondering, can you tell us about, you mentioned that over 40 cities across the world have this type of ban. Can you tell us about how these jurisdictions were able to pass an ad ban, how they resisted pressure from fossil fuel interests?
Mm.
So, yes, this is very interesting. And there has been a lot of pushback actually and because of these bans have actually been quite comprehensive. So the ones in Amsterdam, it doesn't only include like it includes a lot of the secondary products, particularly short haul flights, airlines, cars, meat, as I mentioned. So in The Hague, actually, it was not the fossil fuel companies that challenged the ban. It was an association of travel agencies and the sort of travel lobby that they fought the ban because they could no longer advertise for their short haul flights, and the case went to court, and they lost. And the ban was, because of the health protective reasons and others, they said it was a legitimate policy and that it would lead to reduced consumption of these products. So there's certainly been pushback, and there's attempts to overcome it, but that was a huge legal win. And The Hague was the first. So some of these bans are just the city saying they won't do it on city property. The ones that are really in city law is The Hague and now Amsterdam. And yeah, we'll see how it's gonna continue to expand.
Great, thank you, Leah. And lots of questions now that we have 4 minutes left.
Yes,
But
of course.
the next one is what might be accessible strategies for organizing the healthcare sector around a fossil fuel advertising ban? What are initial steps?
I mean, first of all, making sure that fossil fuel companies are not sponsoring health professional association events or hospital-based events, which we have seen. We've seen fossil fuel companies sponsoring health-related talks and have had to respond. So that's like a first step. I think also engaging in this public education and media engagement to raise awareness about the fossil fuel health impacts, especially fossil fuel air pollution. Like people still don't really understand the extent to which it harms health. Um, and then I think also advocacy through professional associations to support this kind of structural policy development.
Great, thank you very much. And then how can principles from the fossil fuel ad ban be transferred to online gaming regulation? And in which ways has AI transformed the regulatory process? Quite a complex question.
Um, so I'm not an expert on online gambling regulations. I believe that there are already some existing restrictions on ads for online gambling, but I would need to look into them uh, in further. Yeah, I would need to examine them. I mean, of course, it's another harmful behavior. Um, and in what ways has AI transformed the regulatory process? Well, um, also a very good question, but I'm not. I'd say it's early days to answer. I think that's something that's very much evolving. Any
All
thoughts, Sam?
right.
No.
I think this is, thanks for that. It's a tough question to tackle.
Yeah.
So appreciate your effort on that one. I think this is probably going to be our last question. So, what about fossil fuel companies who promote the renewable segments and philanthropy from such companies?
I mean, a lot of that is greenwashing, right? Like the renewable segments of BP oil is like less than 2%, but they ran an ad campaign where it was like 99% of their advertising was all about the renewable energy segment. So, um, yeah, I mean, it's often greenwashing.
Yeah, I would agree that I think it's complex. I mean, for example, it's the same thing here in Quebec. All of Énergir, I had shown one example before that all of the advertising from Énergir is for renewable natural gas when it's less than 1% of the fuel mix. And their ads are about a banana peel, and they say, "What if we could make gas from household waste?" That is not happening. And there's of course a limit to how much renewable natural gas we can, or methane gas. Sorry, I saw that previous comment. How much renewable methane gas can be created, where it comes from, how it's created. So they're very complex issues. And when they are presented to the public, as a two-page ad or meme, it usually is just greenwashing.
All right, thank you. And thanks to everyone here for joining us, and thank you to our speakers, Doctors Temper and Green. We are now out of time, and we really appreciate your insightful talk and to all these interesting questions that we've had. I'm just going to close by saying, with a reminder, basically, just to check our website and YouTube channel for this and other recorded seminars and links to Collaborative Center resources. Brittany has kindly posted these in the chat, and we hope to see everyone next time. Take care.
Thank you. Uh, Feel free to reach out also. Leah at cape.ca.